Hello and welcome to the Real World Real Supervision podcast. My name is Kristen Velasquez-Kennefic. I'm a licensed clinical psychologist and one of the co-hosts of this podcast. We would like to thank APIC for funding this project and hope these conversations will be helpful in amplifying the discussion around intercultural supervision for clinical psychology trainees and other mental health professionals. Today, our guest on the podcast is Dr. Paula Castillo. Dr. Castillo received her doctorate in clinical psychology from the California School of Professional Psychology. With over 25 years of clinical experience in various settings, both clinician and clinical supervisor, as well as adjunct professor. Born in Guatemala, she is bilingual and bicultural with specialties in human sexuality, trauma, couples therapy, family therapy, and culturally competent practice. As clinical director of Centro Castillo in Chicago, she is fully dedicated to creating an environment of learning, growth, and healing to all who enter the center. Grassroots efforts such as being a Peace Corps volunteer, suicide hotline counselor, and participating in an annual medical mission trip to Guatemala continue to foster her passion for social service. Dr. Castillo is very humble, and what I will tell you is she is a leader in the Chicagoland area around issues of Latinx mental health, and we're just so honored that she participated in this project. I'm sure you're going to learn a lot from our conversation. Thank you, Dr. Castillo. Muchas gracias. Welcome, Dr. Paula Castillo, to our interview series, Real World, Real Supervision.
Good afternoon. I'm so happy to be here with you, Kristen.
I'm so happy to have you. So, today we're going to be talking about real issues in supervision. We came to this project really in the middle of the COVID-19 pandemic and a lot of social unrest, really all over the globe. And, we want to talk to supervisors who are on the front lines, doing this work. So maybe before we get into the questions, you can just tell our listeners a little bit about your clinic and kind of the mission of your clinic, if you don't mind.
No, absolutely. So I'm clinical director at Centro Castillo for Personal and Family Wellbeing. And as the name connotes, Valley is really about focusing on the Latino community, not just as individuals, but supporting the family concept. And all the therapists have to be bilingual, bicultural. We, of course, have accepted a couple that are not Latino whom support that mission, right? And the idea of how important it is to do culturally competent work in the language that is preferred by the patient so they can express themselves and get the most out of therapy.
Mm-hmm. That's amazing. And how long have you all been in operation?
14 years.
Wow, that's amazing. Well, we're so blessed in the Chicagoland area to have you and your staff as a resource. And also, can you let us know how you identify along any of the personal variables that you want to share with our listeners?
Of course. I consider myself cisgender, Latina, psychologist, humanitarian.
That's wonderful. And when you say Latina, can you be more specific?
I was born and raised in Guatemala, right? So I'm first generation immigration here directly to Chicago. I was here until end of high school, and then I sort of traveled a bit the world and everything until I finished my doctorate from the California School of Professional Psychology. And I thought about where would I want to develop that practice. And I realized I'm a Midwestern girl at heart, so I came back to Chicago.
Despite these winters, right?
Absolutely.
Okay, great. So, getting into some of our questions, we're wondering what has it been like for you to be a supervising psychologist in the context of racism, equity, and social responsibility over the years? So, both just thinking about, what it might have been like starting your clinic 14 years ago, what it's like now, just with everything going on in our world.
Okay, thank you for that. I started my clinic as a vision of what was missing in Chicago, right? So I graduated from the said California school where I felt I was really privileged to be amongst a group of professors and other colleagues of color, where really being non-color was the minority. And so I came to Chicago, and the nonprofit I worked predominantly served children of color, right? Black and brown children through the DCFS system, but the leadership and most of the therapists were white. There's where I became a supervisor, and I saw the difficulty in being able to get them to understand and not be defensive, right? About helping them see that just being in the system and then participating through a therapy in a different perspective would be much more healing than if they just saw it as, oh, we're just doing therapy for children, right? I was there for 4 years, and at some point, I just felt like I could not continue to be having one of the few people having this fight, right? And in fact, I actually got pushed out of that agency because I kept on encouraging that we needed to address with leadership how to please be different, right? And leadership themselves said, well, then I guess you can't support us. And so, it's okay for you to go somewhere else. And so I did. Because I figure that the best effort is one that's actually being received, right? And then it's being heard by people who want to grow. And so then I went to a private sector thinking that I could then provide the services to Latinos whom actually have insurance. Nonprofits are not the only place to work with Latinos. And so I went to a practice where it was just a beginning and growing. And I was there for 2 years, really focusing and developing that practice for another clinician, helping them grow. But the whole time was similar experience. I was the only therapist of color, and I was the only one really bringing up the issue, saying, if we're going to work with people of color, because I was the only one that worked with people who didn't speak English, right? So it felt like I was, again, just hitting my head up against the wall, and I just couldn't do that anymore. Right. And in that particular practice, I felt like there was a lot of racism. And so I felt that I'm going to put my effort and build a place. And that's how Centro Castillo was founded, on the premise that we had to have a place where clinicians really didn't have to keep fighting, that they can actually spend their energy growing, right? And working with like-minded individuals who wanted to share and wanted to work collaboratively. And you didn't have to constantly tell the other clinician, maybe the way you're perceiving that parent is actually pathologizing them, right? Instead of encouraging their cultural perspective in how they're going to parent their child, which happens to be my patient, things like that, right? So then Centro Castillo got founded. And I think that one by one, we started growing in from one practice to 3 practices, with 3 locations, with the idea that each site needed to be in a Latino neighborhood, because people of color should be able to have services, right, in their communities and not feel like they have to go out to be able to get served.
That's incredible. I mean, what a tremendous resource. And so it must feel so good for you to have this clinic where you can set the tone, you can support your staff, to have these conversations about, structural racism, the ways in which clients of color don't have access in the same ways that others might.
Absolutely. There's no barrier in terms of what language they even want to talk to each other in the office, right? A lot of times the therapists themselves describe their experiences with their patients in Spanish versus in English, or when we're having lunch and a break and time for us to collaborate with cases, people are able to focus on what they really need to, right? Because they're able to talk and they're able to ask other clinicians, like, how did you handle that? because I didn't know how to handle it with my mom, the mom that I'm working with versus the mom that you're working with. And so it really does give an open space for all clinicians to ask questions of each other and not feel like they're going to be judged because of what topic they're trying to bring up.
Or that they even have to explain, right?
Exactly. That's the key part. That was what was so important to me, because you're not pathologizing patients when you don't have that cultural competency. And then, of course, could also include people of color when they don't have that same self-awareness. Then you're having to explain why maybe an intervention you did isn't appropriate.
Yeah. Oh, I love that. It's such a great resource. So, I think I know the answer to this next question, but just wondering if you could share with us, if you've had the opportunity to do your own work around your own identity, any racism that you may have experienced over the years, and if you're willing to share that.
Oh, absolutely. I think being a role model requires you to want to share your experience so that others are willing to be vulnerable. Like I said, I came here, and I just accidentally ended up being in pretty much all Irish neighborhood. And so then from the very early age, I was one of few people of color that I was ever around, right? And so my friends and their families unintentionally were constantly slapping me in the face with microaggressions, right? Of course, I'm about to turn 50, so we're talking about way back in the 70s. People used the word stick. And on the occasions, I would have the courage. And I say courage because when you're the only person that's trying to speak up and you're a teenager and you're trying to fit in, it's hard, right? And so I remember trying to say, hey, don't use that word, I'm right here. And then responding with things like, hey, you're white Spanish. And realizing that my identity as a Latina was what was the forefront for me. Not a woman, not anything else, but as a Latina, because they were making it be what was most important about me. And so that was grateful through high school. And, having gotten a scholarship and stuff like that, I went to an all white school predominantly. That was the only Latina in my whole class. So that kind of separateness. And most of the students took time to accept me. The teachers, I think, were different. They certainly accepted me from day one, but I think the students did take quite a bit of time. And there I also experienced a lot of microaggressions. So when I thought that I was going to grad school, I thought I had been doing my work, right? Constantly having to figure out how to be proud and how to be confident and how to see how racism was affecting me. And because I went to the California school, I went to the multicultural track. So from the very beginning, it was a multicultural community clinical, right? And so my peers were actually people of color. Most of them were Black women. Then the next biggest number was Latina women. And there was just a few men and a few people that were white, right? And this is the first time in my entire academic career where I was surrounded more by people of color than by white people, right? And I went in that first day, and the professor was talking about how are we going to be able to accept if other people are at different places than we are, right? And I remember feeling like, well, I think I can do it, because I know that it took me some time, and I felt like I hadn't internalized racism at that point, right? And I remember saying it to one of my good colleagues there, and she was like, really? You don't think you've internalized it? And I said, I don't think so. I think I'm constantly facing it. And it wasn't until like the third year of my doctoral program where it really hit me. And it was such a humbling moment to realize that even I, whom I thought was so astute, thought I had been actively working on not letting myself enact racist acts and stuff like that, that of course I would have internalized it. How could I not? I'm a product of my environment, right? And so I think it's important to recognize that no matter who you are, no matter how smart you are, no matter how proactive you are, things are going to bleed into your thoughts and ideas. You just didn't see them that way.
Right.
And so I think that
the world we're living in.
Absolutely. So I think that graduate school, and I'm one of those that I'm like, we are going to take every opportunity, right, to explore. So every paper that I wrote, right, everything that I did was like, okay, how can I see what my family impacted me? How did my neighborhood impact, right? So I really do think I did a lot of my work through grad school. And my school required us to be in therapy. I actually thought it was a requirement of all APA graduate doctoral programs. So in order for us to graduate, we had to be signed off by a licensed psychologist indicating that we participated in 45 hours of therapy.
That's incredible.
And so it was amazing. And I really think every program should be doing that.
Yes, I really agree. your experience resonates so closely with mine. I went to a professional school in Chicago, and we had these weekend intensives called treatment issues. And, probably they wouldn't be allowed to do this anymore, but it was very confrontational, very emotional, but it really broke us all open. It made us really look at these messages that we had all internalized.
Mm-hmm.
And I'm a few years older than you, so it was, really around the same time in the 90s of doing that work. And it changed me forever, but
Absolutely. For the good, right?
yeah, for the better. So thank you for sharing that. And just reminds me of those experiences that were so valuable in my own identity development. So what do you think are some barriers that you might have encountered as a supervisor working with supervisees to help them become more multiculturally competent? So any barriers, institutional barriers, barriers in the field?
Mhm. So as I was sharing with you earlier about what really brought me to this podcast was the idea of it being real world supervision, right? And then I had made my career path shift to being in the actual clinical world rather than academia, research, anything like that, because we all have to contribute. And this is my area of contribution. So when I see someone now, it's different than when they were in students, right? Or when they were in their internships. I see them postgraduate. And so they do the internship hour, not the internships, the pre-license hours with us and their postdoc hours. And a lot of times when I interview people, when I'm really first getting to know them, I see such a lack of consciousness of how important theory is, right? And how they can then see that how we incorporate an individual into theory is where we incorporate the multiculturalism, right? The theory doesn't change, right? Theory is theory, and we have a foundation of how to help people, but we need to understand how culture impacts people, right? And that part is missing. So while it's being taught, I don't know how they're being assessed if they know it well enough, right? And so then they go to their internships, right? And so then I think that the internship supervisors are also maybe lacking in being able to challenge their supervisees at that level, right? In making sure they understand the theory, but also in beginning to bring up the issues about culture and the different sectors that they may be able to interact with their patients. Because if they're just hearing it for the first time, by the time they've come to me, by that time they've had 2 to 4 years of education, right? Postgraduate education. They've had 2 or 3 internships or placements, right? And so by that time, it really shouldn't be one of the beginning moments of them doing this work.
So it sounds like what you're saying is that you don't feel like the students, the trainees are well prepared to really do this work.
I think that they're being let down. I do. Of course, an individual personal responsibility, right? You should also say to yourself, am I learning enough? Am I prepared, rather than just, did I get an A and then I can move on to the next class? Right. So there's certain personal responsibility that I think it's a barrier, right? Mm-hmm. But they're not the ones there that are seeking the guidance, right? They're the ones that are supposed to be receiving guidance from those in leadership. And so in their internship sites is their supervisors, and in the academic world is their instructors. So I don't think they're being prepared enough. I think that's the biggest barrier when I get them.
Right. And so do you have any thoughts about how we could do a better job preparing them?
Thank you for that question, because I do think that I have personal critiques that I would hope would be helpful. One would be, I don't think anybody should be accepted into a total program who hasn't had real life experience. A lot of people are accepted fresh out of college. And while certainly you're smart, right? You've demonstrated an academic ability, how much do you understand of the world and of yourself, right? And in psychology, what we're doing is helping people improve their lives for themselves, right? Understanding their own sense of selves. And how can we do that when we truly don't even have their own personal experience? So I do wish that there was at least a 2-year, let's say, requirement of real life experience before you got to go into the electoral programs. So that's one. Two is, I do think that supervisors and internships should be held to higher standards. I think they need to have some kind of checks and balance, right? So that they're able to demonstrate how much their supervisee has learned. I know that I'm not going to put my name to someone's hours, clinical hours, and say that they've been well trained and then have it be a poor representation of me. And so I wish more supervisors sort of took that stance of saying, you know what, I'm saying I supervise this person. So I want to assure that they are actually more advanced than they came, you know. So a lot of people, when I do the supervision, they indicate that they haven't been challenged to the degree that I challenge them. And so then that makes me in awe. It really puts me in awe to think that I'm one of the first people who truly have challenged them. You know, you had made a comment earlier about how confrontation, that class, right? Because I taught at the Illinois School of Professional Psychology, that diversity class. I taught it for about 4 years. And I actually loved that class. The whole reason I decided to do that was because I do think that students need to have access to this education, right? And having come from the California school, I was shocked, to say the least, that not all programs were that focused on the cultural piece. So I looked at this as an opportunity to really bring that to a lot of students' experiences in terms of how they understood their knowledge. But I had very few people of color in the classes, you know, and so while I definitely think that non-Latino or Black students should have access to that, that's when I made a decision that my focus was going to be more in the clinical world, and therefore take on trainees like the LPCs, MSWs, that have to really help them do their clinical work, right? But I think challenging them is not the problem. I think the problem is not helping the student or the supervisee understand how to tolerate the discomfort that they feel, right? Because confrontation isn't conflict. And I think it becomes conflict when an individual can't tolerate what they're being asked to think about or ponder, or even being addressed. You know?
This is such a critical issue. I'm so glad you're bringing this to the conversation, because I think it's true. And, you know that I was in academia for 14 years. I recently made a transition to a new job that's outside of academia. But as the years went on, what I noticed is that students got less and less comfortable with, calling attention to their blind spots. And I don't know, it could be a generational issue, right now with, for example, possibly educating millennials. I mean, I think that's
it could be, but that means they're the graduates of now and the therapists of our future, right? So we still need to find a way to help them tolerate.
Oh, I agree 100%. And so how do you do that when you're in supervision and something like this is coming up and you want to challenge the supervisee? I don't know, do any examples come to mind?
I think the way that I do it is that I show my own vulnerability, right? I set the premise of how important it is just to do this work. And I set the premise that I'm not there to judge them, but I am there to help build them up. And then my expectation of them is that they're going to do the work. Not that it's going to be easy, right? And that as long as I see that they're trying, that they're really trying to grow and develop, then we don't have a problem, right? It's really about helping them see that it can be done. So I show them my own experience, right? I share I do it a lot through metaphors or through personal experiences, because if you externalize it sometimes to people who are having more trouble, right? I'm not talking about the ones who's openly, yeah, tell me how, what I'm doing. I'm talking about when you see a little bit of that resistance, right? I think if you externalize it and kind of help them see, look at this concept that we're talking about. And then once you get them to see, okay, I get it. I get how that could have then, been biased toward that individual. Then you're able to say, now let's sort of look how what the parallels is with some of the things maybe you did or some of your own experiences. And hopefully that would have lowered their guardedness already, because now they have understand it instead of sort of feeling like I'm being guarded and I'm not understanding the concept yet, right? You don't have to be on guard. So I do it that way.
That's an excellent strategy. So it sounds like what you're saying is the supervisor has to be willing to be vulnerable
Absolutely.
and share some of your own experiences with the supervisee, because we're all learning and growing. And even psychologists who have done a lot of work on themselves, we still have to check in and make sure that we are holding ourselves accountable, right?
Absolutely. I'd say to them that seasoned becomes the 10 years, right? You cannot be seasoned when you first come out of school, right? You're just learning. And so if you have that perspective of like, I want to learn and to grow, and then once you feel seasoned, then you still have to grow, right? But at least you see yourself that this is supposed to be the process you're going through, and that it's okay to be seeing your mistakes, right?
I think that's an excellent point, that you're never finished doing this, that
Right.
it's throughout our lifetime that we are constantly using these self-reflection. Self-reflection is a competency that we want to see in psychology students, so that as psychologists, we keep reflecting on our experiences and growing and learning from them.
Well, we have to, because the population we work with change.
Right.
So you may have worked with adolescents your entire career, but the adolescents of today are very different than the ones of 2 generations ago, and certainly very different than my generation. So how can you not be growing when your population is changing?
Absolutely. Now they're practically born with a cell phone. So it's so much to deal with
Right.
technology. That's a great point. I'm so glad you brought this up. I think this is a really important piece of our conversation today. The work is never done, that we are constantly working on ourselves. So, but just getting back to something you said a minute ago about the internship supervisors, I would presume then that we would expect that the internship supervisors have done their own work. And then that might be true, or it might not be true. So I wonder if you have thoughts about even, postgraduate training for supervisors.
I think that is exactly what I meant when I said that the institutions need to be holding their supervisors accountable. Make sure that they're growing and they're demonstrating what they're actually teaching and how they actually bring it to the table, versus just looking for opportunities where the students can be placed. Look to make sure that the supervisor is continuing to learn and to grow.
Yeah, it makes me think, how in Illinois we have the CE requirement, and I think you have to have 3 CEs with ethics or something.
Yes, 3.
And so it makes me wonder if the field could think about, well, maybe you need 3 CEs or 6 CEs in multicultural competence.
I would fully support that. Because that is not about even being a supervisor. That is about the work that you do. Right. So if you're going to be more culturally competent, then by definition, when you become a supervisor, should you choose to take that on, you would have more of that foundation.
Right. Yeah. Well, this is really such good ideas. I'm so glad we're having this conversation. Okay. So, I know does your clinic work mostly with Latinx clients?
Yes. The way I look at it is the offices are set up to welcome the Latinx community. The website is so, the therapists are so, but if anyone actually who reads our website says to themselves, that's a place where I would feel understood, we would never turn them away, right? Because that talks about how they see themselves, right? And the experiences that they have. And that's what our therapist should be able to address.
Okay, great. So just wondering, with your supervisees, I mean, I think you've maybe answered this already, but maybe we can just dive a little deeper about how do you teach culturally responsive interventions in supervision? And I wonder if you have any, examples that come to mind of a recent conversation you might have had in supervision.
Okay. I think about when we work with minors, right? Um, I make sure that our protocol, which means that the therapists are aware that in the Latino community, we cannot align with the minor as though we're shifting the family dynamics, right? And then I understand that in Western world, they're like, nope, the minor is the patient. They're the ones to say what we can do. But I try to educate our therapists that we will not going to replace the parents. And it's not our job or role to tell the parents that their Latino cultural values from whatever country they may be or how traditional they may be are inappropriate, right? Many Latino immigrants came because they wanted access to education and providing a different future to their children, not that they wanted a different culture for their children, right? And so then we require that the parents start together with in the intake, and that a child is never allowed to ask the parent to leave the intake, saying like, I don't want to say that in front of my parent, because there's so much that the parent can give us, right? So the child can step out, and there's certainly topics that we shouldn't discuss in front of the child, because again, we're undermining the parent role and the authority of the family. We also never use interpreters, right? So when we have had a therapist that speaks Spanish, but is building on their Spanish speaking skills, unless they can communicate with the parent, they don't get a minor, right? Because we will not risk that the minor is going to be interpreting, or that a non-parent will be the one that is hearing directly to the therapist and have access to that, right? So I think that for me, that's even an example of from the beginning, we try to get the therapist to understand that in the Western world, right, we would see a minor very differently than in the Latino world. And that's not our role in therapy to sort of shift the parent. Our role is to help the child maybe adapt and understand the challenges of being a part of a family system that doesn't look like the outside, right? To strengthen the family, to kind of help minimize the conflict that's in that family, but not change the parents' goals or values.
That's a great example. And I know, I too did a lot of work with kids and teens for the first 10 years of my career. And I struggled, when I would be maybe working with the parent and someone else was working with the kid in a clinic. I often struggled with this very issue, like when we'd come together to do like a joint session. And so to hear you kind of name this is really validating, because I do think that psychologists and therapists do really need to understand the culture of the client. You can't just walk in and say, okay, I learned whatever, I don't know, Bowenian family therapy, and I'm just going to plop it on this family without understanding that cultural context.
And a lot of our therapists today, the newer ones, are not first generation immigrants, right? They're already maybe second or third generation. And so their experience in their own family may be much more similar to the American, more Western view of what a child should be allowed to do. And I think it's those therapists that I really want to encourage to understand that their own personal experience and their own conflict in their home has to be identified, and they have to be very closely monitoring if they're acting that out, right? That to be culturally competent means that acculturation comes at a different place and at a different speed in different families, right? And that if you're working with a family that does not want to acculturate or is trying to find a biculturalism way of managing their home, that may be different than the way you were managed, right? In my home, we weren't allowed to speak English. right? That's the only way I was going to maintain our Spanish in the culture. My dad would say, inside the house is Guatemala, right? So I can appreciate parents who say that, right? But I also can appreciate when a parent comes to me and says, I want my child to adapt. I don't want my child to speak Spanish because, they get made fun of, and I want them to, be more Americanized. Again, it's not my place to tell them, but really you should keep them learning Spanish, right? So that would be an example in the opposite direction, right? That I have to listen to the parents and understand that their value system is what I'm working with.
Yeah, I love that you're bringing up this issue of acculturation, and I think it's so critical, especially for our immigrant families, because we know from the literature, I mean, here's where I think the literature really, helps us, that family members coming from the same place can acculturate at all different paces, right?
Mm-hmm.
You can have the immigrant parents who are really holding on to the culture of origin. And then you can have teenagers who are like, forget this. I want to be American.
Right.
Oh, I don't want to speak Spanish anymore at home. And I know that when I was doing family work, with Latino families, that was something that came up quite a bit, is
It's
helping.
also interesting when you have multiple children in the family, and some of the children want to be more Americanized, some of the children align more with the parents. Yeah. And understanding that that's a normal process because there's different personalities, right? Different family roles. And so even in one family, we might have to deal with all those dynamics and still understand that the parents are the ones that are leading it.
Right, right. And understanding, that I'm trying to think of the word, el respeto, no? The respect is a
Mm-hmm.
very strong cultural value, having
Yes,
respect for the parents.
absolutely.
That's a great example. I love that we're talking about this because we know that Latinos are one of the fastest growing groups in the
Mm-hmm.
US, and are also, um, present for therapy in very high numbers. And so, wanting to help people understand some of these really nuanced multicultural issues and how we translate, like you're saying, theory to practice.
Right.
Yeah.
Also, how to translate that though with non-Latino or non therapists of color, right? I know that if we are trying to encourage Latino populations to come, right, lower the stigma, and yet there's still some people that will wait for a very long time. And so then when they come into therapy, they're presenting with higher symptomology, right? Just because they were waiting and waiting, right? Not because there's a greater number of pathology in the Latino community, but rather than the person waited too long and they're having panic attacks and depression severe, right? Or now they're having anger management. It's very different than if someone had come in early on. And so
Yeah.
how do we see a person non-pathologically, but still treat the symptoms, right? Recognize that they're in a very dire state and view them in a good way.
Right. That some of these reactions are, just totally understandable.
Mm-hmm.
I think of the years when Trump was president and all of the issues around immigration. And I think a lot of Latino clients were presenting in higher numbers with anxiety. I don't know if that's consistent with your experience.
Absolutely, absolutely. We saw a huge number of increase with the LGBT community coming to therapy because of the Trump experience, but also because of the family division that came out when LGBT members in the Latino community were seeing that their own parents were aligning more with Trump, right? So that was a segment of it. But I also saw a lot of individuals who don't have legal status, right? And then the fear that came up with that. And so at Centro Castillo, we don't worry about status. We don't, in terms of like having them come to our services. So we assure them that they're here at a safe place, but we've really done a lot of work in doing the immigration evaluations, right? and have those be very culturally minded. Because I think how you write about an individual, right, makes a difference in how a person is perceived.
Oh,
And
I'd
so if,
love for you to say more about that because I don't think that's come up in any of our other interviews.
okay, so obviously the government is saying that there's various types of visas that an individual can apply for that would give them an opportunities to have pathway to citizenship, right? So it's not an automatic, but a pathway to it. But in my mind is, if the government is saying you have to prove to us that you are an individual worthy of this, right? That they're going to be really scrutinized, right? That's one. But two, we don't know if the lawyers or the judges, that are reading these evaluations are individuals that are open to the idea of, hey, we need to help individuals, we need to welcome individuals into this country, right? We don't know their biases, right? And so I think that it's very important that the writing of these evaluations don't accidentally, right, or unintentionally reinforce negative stereotypes, right? And that they are written from a perspective of how do we humanize these individuals when outside people are not humanizing them. They're just seeing them as these illegals, as these people who are breaking the law that need to go back, and they don't see them as humans, right? So when I edit all the reports, when I work with my supervisees on writing these reports, I specifically highlight the differences in writing sentence A versus sentence B. And I tell them, look, this is the kind of thing that you might be accidentally bringing up, like meaning pathologizing or reinforcing a bias.
That is a great, great service.
Well, it's very valuable that the more people whom are educated in how to write thorough immigration evaluations and are attending to this are made available to the community.
Yeah, that's really great to know that you all are doing that important work.
Thank you.
So, as a supervisor, how do you take care of yourself? Because we know that self-care is really important to prevent burnout. And so just wondering both, how do you do it and what do you recommend, to your staff and your own supervisees?
Okay. I guess this is sort of multifaceted. For me, being a psychologist is a calling, right? Centro Castillo is a mission. It's not a job, and it's not. So I don't see it as something that's burdensome. So I think on one level, that's important, that you need to see that the work that you're doing, the environment that you're working is nurturing to yourself, because you are spending a lot of time there, right? And you are giving a lot of yourself. So that's why I think that I created that place, right? So that it wouldn't be an additional stressor just being around and having to fight, for your patients. So I think that's one way of self-caring. The other way for me is that I use my mind and my soul, like my free time, to have to do something that is nurturing to my mind or my soul, right? So I like creativity, right? I do a lot of construction, as I bought condos, I break them down. I participate in all that stuff because it gives me a physical way, right, to everything, take out frustrations. When I do an immigration eval and my heart's breaking, right, at the frustration of the system, right, there I am with a hammer, right, and I'm breaking down a wall. So part of it is I have to make sure that I spend my time doing something that is really releasing, right, but also nurturing. So I love creativity. I do international travel. I know more about outside the United States than inside the States because I like to go learn about cultures, right? And so I do international travel a lot. And then I also do a volunteer work, right? Because I think if my soul is nourished, then I'm at peace and I'm good, right? So my free time is doing that. So that's for me. I do encourage therapists to take care of themselves even during the workday. So we have it set up so that there's actually mandatory break time, where people are not allowed to set therapy appointments, because I want them to make sure that they've eaten. If they have a full day, you need time to stop, eat, rest, but also to be able to collaborate with your colleagues, right? To find some fellowship, break bread with them, enjoy a little meal. So that way you can be refreshed for the sessions that are to come, right? So that's a requirement for me, is that people have that and they respect those limits.
I I love that. And I wish all training sites would do that. I remember when I was a practicum seminar leader, my heart would break with students telling me, they wouldn't have any breaks. They'd be just
Mhm.
munching on nuts in between sessions. And I thought, wow, it's really not good for you.
No, it isn't. We have a start and an end time, right? And also because we do family cases, I want to make sure that when I'm working with mom and you're working with the child, that we have the same start time. I don't want a child out there by himself in the waiting room, right? It's
Right.
more productive for family work, right? But then when we have break, you have break. Please don't close your door and hide away in your office. You know what I mean? Use it to relax, to enjoy some time with your colleagues. We also do an annual like outing of some sort because it's time to celebrate them as people, thank them as people, but also as professionals, right? And so we do something that's fun. This year, I took them to the Latino nights at the White Sox. You know what I mean? Something that's really about fun. Let go, forget about the work that we do, and enjoy each other's company, right? So I do that as a center, but I also want them to maximize their time at work so that they can leave work at work. You know what I mean? So teaching them how to manage their caseloads, how to do the good rescheduling so that, hey, look, these are my work days. This is when I see my patients. And you've gotten good at that so that when you're done and you're not at work, you don't have to worry, right? So I think that's even a sign of self-care, realizing that if you learn and build your skills, then you work less, right? You work smarter, not harder, right? Type of thing.
Not harder. That's great. I love that.
Mhm.
Yeah. So, what keeps you going on your journey? How do you stay encouraged, despite any setbacks, despite, the political and social climate?
What keeps me going is when I focus on the patients that we're serving, because I do believe that an individual can make an impact locally, globally, nationally, right? And so my impact, my life's work is at the local level, right? Hopefully long term, because I'm helping families, right? And then for generations to come. But I know that I'm not in politics. So by that, I mean, like, I can't be so stressed by everything that's going on in politics that I can't help my people, right? And my patients. I see that I can focus and I can continue on this journey if I focus on what I can do, right? That doesn't mean we don't address the issues of politics and sessions. No, I'm talking about that what keeps me in my journey is focusing on what I can do, how I can contribute, and not focusing on all the obstacles that are there. And I hope and pray that there's other professionals who pick up the baton in those areas, right? That together as a whole community of professionals, we can do it. So there's professors who are doing the work that I do, right? That there's litigators who do the work that I do, right? That there's politicians who will do the work that I do, because then there's clinicians and supervisors that do the clinical work, right? So for me, it's that, right? Know what I can do and do it, right?
Yeah. Well, I mean, it sounds like you are constantly learning and growing. So I don't know if you feel like you would need further training in this area. So I guess wondering, I mean, I know we touched on it before, but as a field, what do you think would be helpful, for our trainees of the future?
You know, those classes that we're talking about, the multicultural diversity classes, I wish they had those as postgraduate, right? Because then you would have a self-selected group of people who would be going because they want to do that work, which I hopefully would, translate to they're more open to doing that work, and then they can bring it to their patients or to their supervisees. So in that kind of training, I think that there's a lapse, and I really hope there would be more. I would love to participate in those because I think you get from something like that, but you also can give, right? So you want people who also have some growth in that area to participate in those things, right? So it's a give and take.
That's a great idea. That's a great idea. Well, I just want to thank you so
Mhm.
much for having this conversation with me. I learned so much from you, and I think that this conversation is really going to contribute to our project and to help people kind of keep thinking about how we can support our supervisees in real world supervision.
Well, thank you to you and your colleagues for even doing this podcast. I think it is a great opportunity for others to sort of listen to our experiences and see what morsels at least they could take and add to their work.
Yeah. Well, I hope you have a great rest of your day. And thank you so much. Muchas gracias.
De nada. The same to you. Bye.
Bye.